Hello, everyone, and welcome to today's webinar. My name is Zach Ford, and I'm a program manager at Age United, where I work on our harm reduction portfolio, including the Syringe Access Fund. I'm going to be one of your presenters today, and I would like to allow our other two presenters to introduce themselves.
Drew? Brandie? Hi, this is
Brandie, go ahead.
Okay. Hi, this is Brandie Wilson, and I was at Hatcher, and I'm on my way to CRA.
Thanks, Brandie. And my name is Drew Gibson. I'm a policy manager for HIV and drug user health here at Age United.
Great. Thank you both. And thank you to everyone who's on today's webinar. We so appreciate you joining us today to talk about Chemsex and to launch our new toolkit, Chemsex 101, everything you wanted to know but didn't know who to ask. Just to let folks know, today's webinar will last about 1 hour, and there will be some Q&A at the end. And there is a chat function in the lower left-hand corner of your screen that you can use to send us questions, and we'll take those as they come in at the end of today's presentation. So a few months ago, I was sitting at my desk thinking about the lack of resources available for people who use drugs to enhance or facilitate sex. And sex and drugs are two of the most kind of taboo subjects in the United States, and so naturally there's very little information combining the two. And then the phone rang, and Brandie was calling me to ask if I had any resources on putting together a booty bumping kit. I didn't, but I told her what I was working on, and we decided that we were going to collaborate on that. So along with Drew, we have put together this toolkit, and we're really excited to launch and share that with you all today. So just a couple housekeeping items. As a reminder, we are recording this webinar. It will be available on Age United's websites later today or tomorrow. All participants are in listen-only mode. You can see the number here on your screen to call, or you can join by your computer audio. And we will be doing Q&A at the end. So with that, we'll jump in. Just briefly, this toolkit was truly a collaborative effort involving Age United, the Chicago Recovery Alliance, and Humboldt Area Center for Harm Reduction. And just to give you a little background, at Age United, our mission is to end the HIV epidemic in the United States. And we do that through strategic grant making, capacity building, policy, and advocacy. I'll pass it over to Brandie to introduce the two organizations she's represented throughout this project. And Brandie, I'm getting a little feedback that, that you need to speak up just a little bit.
Okay, how's that? I'll take it off speaker and shove it in my face. Okay.
That sounds better.
So the reason for me why both of them, both Hatcher and CRA are included, is from about the conception of Hatcher. Stacy Cobain, who is the person who really had a lot of lived experience that worked with me, she and I had been looking for booty bumping and chemsex conversations and resources since almost the beginning of Hatcher. And so that has been a driving force, that and my life experience, both, and the things that we see, those have all been the driving force behind Hatcher being involved, and they really are where a lot of the kit tools and the questions, the program stuff was coming from for me. And then how Chicago Recovery Alliance is involved is where I'm going, and it just seems proper that they also are involved, deepening their program's reach and ability into reaching people that they may have never served before. And they also have been very dedicated to ending HIV and supporting people who use drugs in Illinois. So that's both of them.
Thank you, Brandie. So just so folks know, the webinar, or the toolkit, is now available for free on Age United's website. You can go to www.ageunited.org/resources/Chemsex-101, and you can download the toolkit today. So today's webinar, we're going to walk folks through the toolkit, provide you an overview of Chemsex, including the communities impacted and the range of use. We're going to do a description of the different substances being used, including why folks use them for sex, any drawbacks or potential harms, and tips for safer use. We're going to do a summary of education to provide participants the importance of peers and harm reduction strategies. And we're going to provide resources on planning a Chemsex party. So what is Chemsex? Data released by the CDC in July of this year shows total drug overdose deaths in America are down by about 5%, which is the first drop we've seen in nearly 3 decades. However, deaths attributed to fentanyl and methamphetamine are on the rise. We actually see a 21% rise in deaths involving methamphetamine. And data collected by the Substance Abuse and Mental Health Services Administration in their annual survey on drug use show significant increases in methamphetamine use in adults over the age of 26. So with much of federal and state response to the overdose and drug poisoning crisis focused on prescription opioids and heroin, many harm reduction-focused organizations find themselves responding to an evolving crisis without the institutional and financial support that they need. So as trends shift from heroin and fentanyl to cocaine and methamphetamine, it's really critical that education and resources be available for people who use drugs as they transition from one substance to the next. Now, as the administrator of the Syringe Access Fund, Age United receives information from grantees around the country, including details on what drugs are being used and what participants are asking of service providers. A significant number of grantees have shared concerns about being able to respond to an increase in people who use drugs in their communities, particularly around sexual activities. So resources on Chemsex have mostly come from our friends in Europe. So while valuable, their experiences are specific to their communities and the laws of their countries. Additionally, these resources often limit their scope to men who have sex with men, ignoring the fact that other communities also engage in Chemsex. And on a personal level, I used substances to facilitate and enhance sexual activity for many years. And when I decided that I wanted to stop, I found that the established forms of support, such as substance use treatment and 12-step support groups, failed to incorporate my community and culture, especially around things like gay sex, hookup apps and hookup culture, gay shame, HIV stigma, and societal and internalized homophobia. I believe there's a real gap in service provision in the U.S. around Chemsex, so I'm really excited to be sharing this resource and collaborating with folks like Brandie and Drew to raise awareness and provide education. So we've mentioned the term Chemsex quite a lot so far, and I want to give us just a baseline definition to kind of ground us in what we're talking about. So Chemsex can be defined as the consumption of substances to facilitate or enhance sexual activity. Now, multiple substances are often used, and one at a time or combined, and they are used to shift boundaries, to delay an orgasm or extend a sexual encounter, and to intensify sex. Substances are administered by snorting, smoking, injecting, or commonly referred to as slamming, and booty bumping. And when we talk about some of the communities impacted, one of those communities is men who have sex with men. So this allows folks to take sexual risk, discover new sexual techniques, and cross sexual borders. It can be more appealing and easier to try new things, and it makes it easier to switch roles, going from top to bottom or bottom to top. Now, something that we do see when we talk about drawbacks to Chemsex is that you can see lower condom use. Regular use can result in dependency. And something we see is that folks sometimes go to Chemsex to reduce shame or stigma they might feel because of their sexuality, because of an infectious disease status. So we also see Chemsex being used in with sex workers. So this allows folks to not sleep as much. It allows them to not get as hungry. They're able to work more hours and ultimately have more customers. And these substances also can make someone feel more confident. They can make you feel friendlier, invincible. And it can be easier to cope with some of the different harms associated with your work. And now I will pass things over to Drew to walk us through some of the substances that are used.
Thanks so much for that, Zach. In terms of the substances used for Chemsex, one thing that we found when Zach, Brandie, and I were doing research for this toolkit is that there wasn't sort of a common definition of what substances qualified as Chemsex in the United States. As Zach mentioned earlier, a lot of the research was out of Europe, and a lot of that research excluded some substances that were more commonly used in Chemsex or party and play here in the United States, particularly around crystal meth. So we wanted to make sure that our definition for the substances included in the toolkit around Chemsex was very broad, and to provide not only sort of the drawbacks to use that you would normally see from sort of a substance use provider, but also some of the benefits of the use and tips for safer use. So it's a more holistic approach to addressing the various drug use. Just sort of as a baseline, I'll go over one or two of the outlines we have for the substances. For instance, for MDMA, some of the benefits of use are you'll experience extra pleasure, tend to be more free and adventurous, you'll be able to have sex for longer because it will hold off climax, and it will amplify more amorous feelings. In terms of the drawbacks to use, it can make it hard to get an erection, can cause clenching and tensing in the jaw muscles or grinding of teeth, can cause sweating or panic attacks, and there's also risk of heart attack or heart failure, of drinking too much or too little water, or having feelings of depression when coming down from use. In terms of tips for safer use, we encourage folks to drink water, but make sure not to overdo it. Generally, an 8-ounce glass of water an hour is good enough. And to be kind to yourself in the days afterwards, and allow for time to rest and recover after your Chemsex session. Just one more in terms of benefits of use, drawbacks, and safer use. For alkyl nitrates, or otherwise known as poppers, the benefits of use are they expand blood vessels, allowing for lower blood pressure that raises heart rate, gives sort of a warm and woozy and horny effect that lasts for a few minutes, and increases desire to both perform penetrative sex and to be penetrated. Poppers are particularly suited to bottoms because they help relax all of your muscles, including sphincter muscles. Some of the drawbacks to use is that you can actually burn your nose quite badly while applying the drug, and they can also burn the skin on contact. So it's important to be really careful when using poppers. Some find the dizziness is unpleasant and cause feelings of being like you're about to faint. And it may cause you to lose your erection because they also expand the blood vessels. It can also cause headaches. In terms of tips for safer use, do not take poppers alongside erection pills like Viagra or Cialis, as they both affect your blood pressure, and combining the two can cause a heart attack. Also, like we mentioned earlier, make sure to avoid having poppers touch your skin, and if it does touch your skin, rinse it off immediately with water, or if it gets in your eyes, seek medical help. We also have similar breakdowns for crystal meth, ephedrone, ketamine, GHB/GBL, as well as alkyl nitrates and MDMA. Hopefully, this sort of background of the drugs will allow folks to have a more informed approach to Chemsex, both if you are yourself engaging in Chemsex, or if you're a provider or community member looking to be educated on the subject. So hopefully that covers that, and we can move on to service provision. Zach and Brandie.
Okay. Hi, this is Brandie. So I'm going to talk about service provision and general services. So to start, a lot of times when we talk about drug use, we think about our syringe service programs or our overdose prevention programs. And we need to make sure that when we are creating programs for Chemsex, that it not just be focused on syringe service providers, that it be critical that we build education, resources, and programming into all HIV, viral hepatitis, and STI prevention efforts. There tends to be a lot of stigma by some folks and communities that do engage in more recreational drug use, that they believe they are not, quote unquote, that kind of drug user. And so we need to break that stigma down, because as we probably all know, that drug use is drug use. And we also need to make certain that resources are available wherever communities might access them. So we need to broaden our perspective of what sort of programs we develop and where we put them. And some things that we found through that, and that, you know, over the years I've heard and seen in different program developments, is that programs should be community specific and culturally humble. Those are really important. And different approaches for different groups, because we want to make sure that we reach people with the right messaging that strikes them as interesting instead of turns them off. We need to create services for recreational drug use. That is something that I don't see much of, and as drug use for some people fades away out of chaos into more recreational, that might be something overall we need to think about. We need to think of the different settings they can happen in, that Chemsex outreach can be done. And, you know, a lot of it happens at house parties, but those can definitely be challenging, as well as clubs can also present a service challenge. So figuring out the really creative ways to provide services there would be a really big benefit. And as always, peer-led intervention and outreach is going to be your gold star. Design harm reduction programs for specific target populations. Overarching messages don't always get to the people that we want them to. And partially adapt them from already existing programs that have been proven successful. We don't need to reinvent the wheel. There's a lot of really great templates and structures out there that we can take and implement and then sort of change how we need. As far as the service provision, so general services, much like the rest of our harm reduction work, is risk reduction techniques on routes of administration, sterile supplies, injection supplies, smoking supplies, snorting supplies, and then what I'm really excited about now is later we'll give some information on how to make booty bumping supplies, and services should also have a range of kit options and also a range of condoms and lube, different kinds, because just like people and communities, condoms work better if they are personally tailored. Some more things that are good to have are pregnancy tests, consulting, safer sex education, HIV, HCV testing and treatment, referrals, and job search, food services, safe consumption site, and empty gelatin capsules. That's one thing that I think as a service provider, that's something that I know I've been missing. That's also really important because, you know, we don't just serve people who inject. And then for the MSM services, a lot of them are the same: community tailored, sterile injection or smoking supplies, range of condoms and lube, consulting, treatment for STIs, HIV, HCV screening, PrEP, and hygiene supplies. And now the next group is sex work services, and this is something very dear to me. This is something that is in my history, and it is many of the women that I love and care about and served. And so for sex work services, they also need to, you know, hold community tailored, all the sterile injecting supplies, condoms, lube, treatment, pregnancy tests, and hygiene supplies are really important. And so I think that's all for service provision for that. So now let's move to harm reduction strategies. Will you switch the thing?
Yep, the slides have been changed.
Okay, thank you. So, we have to talk about risk. This next slide is about risks, but it's also about harm reduction strategies. And we're going to talk about risks first. A lot of us know them, but we have to know the risks to come up with solid strategies. And so, a lot of the normal risks that we see in programs and people that we serve is a risk of infectious disease, health risk, socioeconomic risk, drug-related psychosis, affected immune system, poor nutrition, poor hygiene, job loss, rapid aging, dependence, psychological impact, oral health complications, reduced dopamine levels, insomnia, erectile dysfunction. And then with injection risk, we have all of the injections, collapsed veins, tuberculosis, and deliberate. So one of the also risks that we need to maybe start talking about more is deliberate needle sharing that takes place. And it takes place in a number of communities, and a lot of times it is seen as a very intimate, an intimate practice, and it's keeping control of your drugs and your supplies is one of the best strategies that we can have. But that doesn't always happen, right? So let's see. And then there's smoking risks. And with those, dehydration, lip burns, burns to your face, and infections through shared smoking equipment. So with stimulants, as Zach was talking about, overdose has increased nationally, and in small rural areas, it's been pretty prevalent. And so some of the things that I think are really important to talk about real quickly are overamping and overdose indicators, because that's how we know when to pull someone out of the stimulation and sort of try to get them to calm down. And so what that looks like is a really big, there's sweating, there's overheating with no sweat, increased heart rate, chest pains, respiratory issues, and overdoses mainly occur in cases of injection and booty bumping. And that's because once those are in, they're in, and your body's taking in all of it. And one of the things we need to pay attention to as we purchase our drugs and we are taking them, we need to pay attention to the quality of them, because the lower the quality, the more risk of overdose. And that is because people are more likely to use more frequently because they aren't getting the desired effect. So after all of that, warning, let's go to harm reduction strategies, which is the good stuff that we're all here for. So you can stick to a regular sex network, build trust, relationships, put a time limit on sex dates and discuss in advance. Schedule a session at the start of the weekend to allow plenty of recovery time before the work week begins. Now, some of these directly address some of those risks, and I really like that. Avoid open, anonymous parties. Alternate the substances you use and or slam. Adhere to a maximum dose per occasion. So set a threshold for yourself and try to not go over that. Try to avoid combining crystal meth with other substances. I don't know what to say about that. Discuss your personal guidelines and restrictions with sexual partners before the session begins. And I think that's a really good place for life and consent, and especially in Chemsex. Pay attention to the time of intake and avoid taking other doses while the first dose is still in effect. Avoid reusing or sharing syringes, and always use your sterile supplies, your own supplies, alcohol, water, test the potency of your crystal by snorting it or smoking a smaller dose. So just do a little tester before you go all in. Withdraw temporarily from the sex setting, or step outside briefly for fresh air to re-energize and give the body and mind some respite. So that's sort of the taking yourself or someone out of stimulation so that they have time to sort of bounce back. Have a small bite to eat during a session to improve stamina and maintain energy levels. Try yogurt, fruit, protein bars, and shakes, something soft and easy. Take time to clean your teeth and gums after sex, Chemsex. And with stimulant use, make sure you're doing good oral care. All right. So I think now is the kit menu.
Yeah, and Brandie, before we, I'll go ahead and change the slide, but I'm wondering, for folks who are on the call who may not know, before we explain what's in a booty bumping kit, could you let us know what it is we mean when we say booty bumping?
Yes. So booty bumping is when you mix your solution, and a lot of times it's a little more diluted than if you would a shot. And you would draw it up into one of the big barrels, probably like a 3 cc, and you inject it into your rectum and your, is it your capillaries? And it absorbs that way. And so that is what booty bumping is.
Thank you. And Brandie, I have brought up the kit menu slide, so you're good to go there.
Great. And I'm super excited because booty bumping is the first on the list. And the reason I told you at the beginning, but this kit has been such a large conversation for the past few years that I am so excited to see it in like print. Okay, so for a booty bumping kit, and just like most things in harm reduction, this isn't full and complete, right? So we're not saying this is the be-all, end-all, but this is a place to start, and I look forward to seeing like how it grows. So for a booty bumping kit, our basic design is a 3 cc syringe barrel, not the tip. Sterile water, 2 grams of sterile water, 2 packets of water-based lube. That's going to be important for easy booty bumping. A glove or 2, hand sanitizer, and information inserts. And there should also be a, in most kits that will be doing outreach to Chemsex community, there should also be a range of condoms in that kit. And so then we can move on to the injecting kits. And I think a lot of us probably know that. It's the regular basics, 2 iodine wipes, 2 alcohol wipes. Syringes. So stimulant use, what we have found, a lot of folks are using thinner syringes. So they will use a 30 or 31. And whatever gets folks to use the most healthy way is important. And tourniquets, information inserts, cookers, don't forget a paper clip or a bread tie to hold that cooker, and a cotton for filter. And then the great smoking kits, those are pipe, foil, Brillo, a short wood stick, chapstick, gum, sucker, straw, information. And those are because I don't know if anyone's ever smoked drugs before, but your mouth gets real dry. Snorting kits. I love snorting kits. They're bright and colorful. So have a clean plastic card, a small cosmetic scoop, 3 short straws in different colors, a plastic razor blade, and an information insert. And I do want to give some props to Harm Reduction Action Center because they are the ones that I got the snorting kit stuff from. So thanks, HRAC. And then, let's see. Now I think we're back to you, Zach.
Yeah, thanks, Brandie. And I will say for service providers that we may have on the call today, sometimes when I'm doing different presentations, I'll get folks who will ask, what is the benefit of giving out smoking kits, the benefit of giving out snorting kits? I think that, from a purely infectious disease prevention lens, obviously, with smoking, like there are some risk there. But I think one of the really important things about having these types of supplies and kits together is just reaching the communities of folks who might be using drugs in that way. I think that with providing these services, having them available, knowing what you're talking about when you're talking to someone who maybe smokes crystal, and having kits available for those people means that you're engaging that person. You're starting a conversation with them, you're building trust with them, and you're allowing them to know that they can come to you for other types of healthcare services. So it's really about building that relationship and beginning to engage that person. And a lot of times what we see are smoking and snorting kits are really great ways to start a conversation with someone. When you walk by and you've got, like Brandie said, a snorting kit that's colorful and it's eye-grabbing, then folks are more likely to stop and have a conversation with you about what that is. So moving right along, here we have a page, actually 2 pages from the toolkit, and this is our Chemsex party planning guide. And we really wanted to give something to folks that could be used both by a person who is planning to have a Chemsex party, but also by service providers or SSPs, something that they could put out that again would get a conversation started. This is bright, it's colorful, and it's got a whole lot of information on it that would be really good. You could put this into a Chemsex kit if you wanted to. This is going to be available for folks to download and print. But here you have kind of just like a basic layout of like a 1-bedroom apartment. So you can see on one side you have the living room area, you have the bedroom area, and then you've got your bathroom. And so we've laid out everything you would want to do before or as you're preparing for a Chemsex party. So you can see that around the couch area, we've said to put together a chill out corner. You want to create a space where folks can take a break between sexual partners that is conducive to taking a nap and chatting with other folks at the party. It's really great if you're a service provider to be able to give folks information on HIV, PrEP, and hepatitis C that they can put out, and it encourages open and honest conversations. You'll see in the bottom left corner there that there's a sling. So if you're going to have a sling at your party, it's important to have cleaning supplies positioned by the sling so that it can be degreased and disinfected, both the sling and the chains, before changing partners or before switching roles. And that brings us to cleaning supplies. You want to place these supplies strategically throughout the space to encourage sanitation during the party. You can fill a spray bottle with all-purpose cleaner so that surfaces and objects can be easily cleaned. And it's important to have paper towels and regular towels available. Disinfectant wipes such as Lysol wipes are really great to have handy. It's just important to remember to degrease any residue before applying disinfectant. Of course, you'll want to have harm reduction supplies throughout the space, including the kits that Brandie just walked us through. As always, if you're going to be slamming or injecting, it's important to have plenty of sterile syringes available and to never reuse and never share. You'll also want to have safer sex supplies. Whether folks will be using them or not, it's important to put them out, have condoms and lubes throughout the space. As we all know, condoms help prevent HIV and other STIs, and they also encourage open and honest conversations about our health. And then lubricant is so important. We recommend placing it everywhere, all different kinds. It helps prevent cuts and bleeding. Now, a lot of times folks will use saliva. They think that, or maybe they find like the act of spitting, it's hot, but we recommend that folks try to use lube as much as possible because saliva dries up very quickly, it gets sticky, and it leads to easier tears and cuts and bleeding. And if you're using drugs, you're not going to be producing as much saliva, so lube is even more critical to have around. And then if your party is going to involve fisting, we highly recommend having latex gloves throughout the space. It's important to have gloves available to minimize the risk of transmitting HIV, hepatitis C, and other STIs. So plastic sheets you'll see is on here. I've also heard a recommendation that you can use like the dog training pads because they soak up urine. But if your party is going to involve piss play, it's really a great idea to have plastic sheets or the little dog pads. They are much easier to dry up and disinfect. And it's easier to degrease and disinfect plastic sheets quickly when changing partners or changing roles. And then sex toys. So sex toys are very often a part of a chemsex party. And so you'll want to lay out the dildos and toys. You want to keep them apart and keep the unused toys clean. And it's advisable that everyone bring their own sex toys for individual use. Otherwise, you want to make sure all toys are properly disinfected and chloride in water for at least 5 minutes. So paper towels and microfiber wipes. We want to have these throughout the space. Having rolls of paper towels ensures folks have what they need to wipe off the oily and greasy residue. Consider putting out microfiber wipes as well for proper cleaning with the all-purpose cleaner that you've already set out. And then food and drink. Brandie touched on this. It's important to place bottles of water and sports drinks throughout the area. This will help make it easy for folks to remember to drink something. Having a bottle of water on the nightstand or on the coffee table or a bottle of juice within sight helps jog the memory and helps make someone to remember to drink some water. We recommend not drinking more than 3 glasses of water or juice in an hour, as this can cause fluid intoxication. And then things like protein bars or granola bars or bananas throughout the space or in the chill out corner reminds folks to refuel. Sometimes chemsex parties can last a couple of days and folks can go without rest. And so having that chill out space, having a space where someone can grab a bottle of water or a granola bar is really important, especially when you're talking about the come down phase. And then one recommendation we've had is to have a party and play form. So this allows folks to keep a record of what they're taking, when they took it, how much they took. And this is handy for knowing when to take more, but it's also useful to know what you've taken in case something goes wrong. And let's see. So in the bathroom, in the shower, we recommend that folks wash themselves thoroughly with a mild soap and rinse with lots of water before partaking in chemsex. And it's important to wash your pubic hair too, especially afterwards, because lubricant residue containing blood particles can stick in your pubic hair quite easily. Again, with the disinfectant, you want to make sure you have that in the bathroom as well. Clean towels for each participant, leaving more clean towels next to the sling and next to the bed. In the bathroom, you can think about putting a bowl or a bucket. You can fill the bucket with a mix of bleach and water. We recommend a 1:9 ratio. This allows you to disinfect dildos and toys and rectal douches by letting them soak for a few minutes, and then wipe off or rinsing thoroughly with water after they've soaked. We recommend to wipe off any oily or greasy residue before putting them in the bucket. And then rectal douches. If possible, we recommend only using your own rectal douche. Otherwise, wipe anything that you use clean of oil or grease and disinfect it in the bleach solution before use. So that brings us to 2:40 and the end of the toolkit presentation. So now what we'd like to do is just remind folks, that the toolkit can be downloaded on AIDS United's website, www.aidsunited.org/resources/chemsex-101. The slides and a recording of the webinar will be posted online as soon as possible. With our last 20 minutes, we would like to open it up to audience questions. So the chat function is in the lower left-hand corner of your screen. Please use that to direct questions to myself and Brandie and Drew. And as soon as they start coming in, we will begin responding. Oh, and I just had Drew just messaged me to mention that we might want to specify that some protein bars can be loaded with artificial sugars and ethyl alcohols, and so we want to make sure you're choosing protein bars that are not loaded with sugar because they can serve as diuretics, which might not be ideal for chemsex parties. So with that, we've got some questions coming in. And Brandie and Drew, I'm just going to read them aloud and we can respond. So someone asked, what are your suggestions for those that use a shower shot for anal douching? So I guess I can take that one. I think that it's a very similar recommendation to that of a rectal douche. So most shower shots that I have seen, that nozzle, you'll just want to make sure that you're wiping that off after it's been used to degrease and get any residue off. And then you'll probably want to use a really mild disinfectant on it or some mild soap and warm water to rinse that clean. Brandie or Drew, do you have anything to add?
I don't think.
Neither do I.
Great. Well, the next question, and Brandie, this might be a great one for you. What first steps would you suggest to an organization planning to start a Chemsex outreach program?
So I would say find people within your program that you serve or that work there or volunteer there that are interested in this as well, that have lived experience. Always find lived experience because that's how you're going to do it right. And start reaching out to, I would say, maybe programs that aren't necessarily in the quote-unquote drug use community, but more in sexual health, and start finding out what sort of structures or outreaches they do that you might be able to incorporate. I like to start with having an abundance of information to create, get as many examples and ideas that you can get and people interested with lived experience, and sort of have a pile of great ideas that you would like to see happen, and then start sorting through them to find the ones that are feasible, that people with lived experience are in support of, and that, I don't think I've said lived experience enough, but lived experience is going to get the Chemsex conversation where you need it to be. And so I don't know if I said, but lived experience, yeah, that, and just lots of talking and research with, programs that are maybe not directly in drug use, but sexual health too, and figure out how to taper all of that. I think that's all.
Yeah. Yeah, and I'll just I agree with everything Brandie said, and I'll just offer something that I learned earlier this year when I was at a conference that was, it was the International Harm Reduction Conference, and there was a group, I believe from the Netherlands, but I could be wrong. But something that they were doing around Chemsex outreach was they were incorporating the drag and ball communities, and so they were going out. They were creating drag performances that provided that education piece, so that you're going into like a bar, a club scene, but you're not taking it over. You're participating in the normal activities. You're working with drag queens to do some of the education and outreach. You're really integrating yourselves with that community, and you're reaching a whole lot of people in a setting that they are comfortable in and that they frequent quite often. So that was one really cool idea that I heard earlier this year.
That's an amazing idea.
Yeah, it was really cool. So moving right along, our next question is, do any of the drugs used for Chemsex interact with Truvada that's used for PrEP? That is a great question. I'm going to see if either Brandie or Drew know the answer to that.
I do not off the top of my head, and no, I don't.
I would definitely need to look into it further, but it is worth noting that if you are using Truvada for PrEP and also using illicit substances for Chemsex, it's doubly important to make sure that you get your vitals taken in terms of renal function and everything else to make sure that those interactions are safe. But I don't know of anything specifically that has been released in warning against using Truvada for PrEP with these substances.
Yeah, and I will echo that. I am not at all 100% certain, but I think that that is something that we could certainly get back to folks on and post online in the follow-up stuff. But that's a great question, and we thank you for asking that. Next up, we have the question, can you overdose on poppers? So I can jump in. You know, the short answer is yes. Like, I mean, it could happen. So you would, you know, if you swallow poppers, you would need to seek medical help with that. Now, just sniffing them, you know, you would need to sniff a lot of poppers in order to put you into a space that would allow for an overdose. Overdoses on poppers are very rare, but not impossible, I will say. Brandie, Drew, do you have anything to add?
In the research that I was reading, it did say that poppers by themselves are really rare, but when combined with alcohol is when it gets when it gets on, wow, the word lost my head. Poppers with alcohol is where it starts to get on the borderline of pay attention because it might be a little dangerous.
And sort of going off what Brandie just said, it's very important to not or try not to take poppers when you're also taking an erectile dysfunction medication, as both poppers and things like Viagra and Cialis expand the blood vessels, and that can be very dangerous in terms of heart health. So try to avoid taking those two in combination with one another.
Yes. All righty. So next question. Just to clarify, you said for sex toys to be disinfected with bleach and water. Are they safe to reuse after soaking if rinsed thoroughly? So the recommendation is to the ratio of bleach to water to be 1 to 9. So you're using a very, very, very small amount of bleach as the disinfectant. You can also use something other than bleach, but you're mixing it with a lot of water. And then you're also rinsing it thoroughly with warm water after it's soaked for a few minutes. So you'll rinse all of that off and pat it dry with a clean towel, and you'll be left with a disinfected toy. Now, certainly if someone has known reactions to anything with something bleach in it, then there are alternative cleaning products that you could use. Brandie, Drew, do you have anything to add?
I don't think I do, other than, you know, we know that bleach dissipates and stuff after it's dry. So there's lots of things that we disinfect with bleach and then put in our mouths or things like that. That's all.
Yeah. Cool. Nothing for me.
All right. So Someone asked, is there a glossary to explain some of these slang words or terms? I am new to this and don't know some of the terminology. Yes, there is. So it is has a lot of terms in it, and so it was a little bit too much to cover in the hour we had for the webinar. But if you go to download the toolkit at the website that's listed on the screen right now, one of the things in the toolkit is a glossary. And it goes through a lot of the words we've mentioned and a lot of the words that we haven't. So it will be really helpful to folks that are new to Chemsex and want to learn more. So next question. Someone asked, have you covered Viagra and other erectile dysfunction drugs as part of shooting or injecting? Brandie or Drew, do you want to respond to that?
At least in the research that I did, I couldn't find any literature on using erectile dysfunction medications as part of shooting or booty bumping, but we can definitely look into it further. It's not included as with the rest of the drugs in our glossary, though.
Yeah, in the research that I was reading, I didn't see anything directly specifying injecting of those medications. I did run across a number of ones that were like, don't use two different ones at the same time, but I didn't run across anything in discussing that, but I do know that it is possible. That's all I know.
All right. Thank you both. All right, so next question. Any advice for using best ways to use this information with a client who's partying and playing more often than they want to because it allows them to be housed? They have little control over the drugs and works that are at the parties.
I think from my perspective, those conversations always are very, the paths in that are very individual, and maybe sometimes the techniques that someone will develop or come across will actually surface in a conversation that you and that person are having, trying to figure out, well, maybe this might work. And I know that in the toolkit there are different things around risk, and but I don't know. For me, that would come through a conversation. I don't have any specifics.
Yeah, and I think one thing that came to my mind, and is that maybe the conversation should be around housing opportunities rather than substance use at this time. I mean, if someone's using more frequently than they want to, if they're using, if they have little control over the works, then I would say that maybe working with that person on finding housing that allows them to be more in control would be a good place to start.
Yeah, just sort of piggybacking on what Zach just said, I don't know what kind of provider the question asker is, if they are a provider, but even if you're predominantly around substance use disorders, making sure to focus on things outside the realm of just drug use is so important when working with people who use drugs. So sort of making housing a priority for this person might be an even more important intervention than anything that can be listed in this Chemsex resource.
Yeah.
Yeah.
So let's see. We've got another question about substances commonly used in Chemsex interacting with medications that are used for HIV treatment. I think that based on our response to the last one, I think that's a really important question and something that that we can refer to friends of ours that are licensed medical doctors. So we will flag that one and we will follow up with folks. Someone asked, could you address naloxone? So I guess that question is naloxone, having naloxone around overdose prevention efforts around Chemsex. Brandie, do you want to take that one?
Sure. So naloxone work if there's opiates involved, which there may very well be. But a lot of the Chemsex parties and activities are around stimulants. And so having naloxone on hand is just always good because we don't know when we might need it. Overdose at Chemsex parties may look a little different, and naloxone may or may not work because opiates may not be involved. If there is an overdose or an overamping situation, it will sort of look like some of the things we went through on the risks. You know, there'll be overheating with no sweat, won't be able to really tell what is the drug and what is reality. Just not, you know, heart rate that's really over the top, a pulse that's over the top. And so pulling, you know, reminding the person, trying to get them to calm down, and reminding the person that it's the drug, it's not them, trying to get them to maybe drink a little fluids, get them out of stimulation. And because the more stimulation, the more the heart rate, the more everything is going on stimulants. So yes, naloxone, but also and be prepared and knowledgeable about methamphetamine overdose and overamping and how to address that and at what point to go to the ER.
Great. Let's see, we have time for maybe one or two more questions. So someone asked, are there pre-made kits available for safer parties, such as booty bumping harm reduction kits? And if so, where would you recommend looking for them? So that's actually one of the reasons we decided to create this toolkit, was that there weren't a lot of resources out there on Chemsex, on booty bumping. And so we put together within the toolkit, there's a kit menu where we list out how to put together a booty bumping kit, how to put together a smoking kit, what supplies would go into each. And as Brandie said previously, you know, it's not like the end-all be-all. It's really a starting point, and obviously you'll want to tailor those kits to the communities you're working with. But certainly within the toolkit, you can find a list of things that we recommend for a starter booty bumping kit.
I'm really excited about potentially seeing everybody's information in it. Like, I can't wait to start seeing this.
All right, so we have time for maybe one more. Let me see. Yeah, so we had a couple more things on the naloxone piece. I think, you know, with the way that fentanyl is being part of the drug supply these days, I think absolutely, and we can certainly amend the toolkit to say this and put it into the party planning materials, that you'll definitely want to make sure that as part of your harm reduction supplies, you're including naloxone. And so we, you know, I think it's really important that folks have naloxone available anytime substances are being used.
Yeah.
And with that, any other questions we didn't get to, we will follow up with folks. We will look into the interactions of substances we commonly see in Chemsex with both PrEP and HIV treatment medications. And just as a reminder, the slides along with the recording will be available on the website. And you can download the toolkit now. It is available. We want to say thank you all so much for joining us, for being a part of this conversation. This toolkit was really a way for us to begin talking about Chemsex more openly, to begin a conversation about some other substances that folks are using, to talk about harm reduction strategies for that. It's been such a wonderful collaboration with AIDS United and Hatcher and CRA, and being able to work with Drew and Brandie on this. And I really, really appreciate their efforts, and I thank everyone for joining us today. And I will pass that over to Brandie and Drew to say their goodbyes before closing out.
I am really honored to have been able to participate in this. And like I said, I really look forward to seeing all of the different things that people produce and come out with around this. It's just a boilerplate. And I did forget one thing. It's super critical, and it's for sex work and its safety. And sex work and safety, one of the biggest things you can do is keep control of your drug supply and your money. So if you can get money instead of drugs, do that. It's most safe. That's all I have.
Thanks, Brandie. I just want to thank Zach and Brandie for working so hard on this. They did all the heavy lifting. I was happy to be along for the ride. There wasn't much policy-related content in this Chemsex toolkit, as it is more practical in its application. If you have any questions or concerns or issues related to the intersection of Chemsex or stimulant use and drug policy, please feel free to reach out to me, dgibson@ageunited.org.
All right, and just one final thing. I am really excited to let folks know that the toolkit will be available in Spanish by mid-December. And so we will make that announcement and push that out so that folks know when the Spanish version is available for download. And with that, I will say thank you one more time. I hope everyone has a wonderful rest of their day, and we look forward to seeing y'all next time. Thanks so much.